Hi, my name is Susan, and I'm a pharmacist. I'd like to talk to you about COVID and the drug Paxlovid. A recent article in the New York Times cited an NIH study where they looked at over 1 million cases of patients with COVID. And they found that only 9% of those patients who were at high risk of getting complications of COVID actually took Paxlovid. And what they found was when they compared those patients who took Paxlovid and those who didn't, those who did take Paxlovid had a significantly less risk of being hospitalized, a 26% risk reduction. And those who did take Paxlovid, they had a 73% risk reduction in mortality and dying. So this drug actually can help keep people out of the hospital and also keep them from getting further complications if they take the Paxlovid within 5 days of symptoms. So what does this mean to you? If you are someone who is experiencing symptoms, get tested. And if you are 65 and older, you really should be getting Paxlovid. You need to talk to your doctor. If you're 50 years of age or older and have high risk factors such as heart disease, diabetes, respiratory disease, and there's a list that the CDC has, in which I will post the link in the comment section. Please have a serious conversation with your doctor. So the question that I often wonder is, why don't people take the Paxlovid or seek advice from the doctor? And there is a side effect that people may want to avoid, and that's the metallic taste, which occurs in about 5% of cases. But you really do need to assess the risk. If you are one of those patients that are at risk of getting complications from COVID, and then you need to think about the risk of getting this metallic taste versus being further hospitalized and possibly dying from the disease. The second thing that people may be concerned with is getting rebound COVID. So far, the data shows that Paxlovid does not increase a person's chance of getting a viral rebound or COVID rebound. Another concern people may have is long COVID. Long COVID is just experiencing the brain fog and tiredness and other symptoms related to COVID once you have recovered. It's an ongoing problem, symptoms. So currently studies are looking at the use of antivirals in treating long COVID. So Paxlovid would be one of those drugs that are being investigated. So it doesn't make sense to consider Paxlovid as causing the long COVID. So another factor, a reason people may be reluctant to take Paxlovid is that it does interact with many common medications. And the one way that you can address this issue is to talk to your pharmacist and have them check to see if your drug, if Paxlovid, interacts with your medication. If it does, then they can provide you with strategies on avoiding these drug interactions or reducing the risk of these drug interactions. And remember, Paxlovid is only a 5-day regimen. So I just want to also say I'm not paid by Pfizer for this video, nor do I work in any pharmacy, but I do work in a hospital pharmacy, and I do see people getting admitted with progressively worsening COVID. So my advice is, feeling symptoms, get tested. If you're in a high-risk group, talk to your doctor about Paxlovid and get those prescriptions filled. That way you can keep yourself out of the hospital and back to your normal routine. So that's it for my video. If you have any questions or comments, please leave them below. And please subscribe to my channel. I will be putting out some videos in the future on supplements. So we will see you later.